it's Martha again. Now we're going to talk about highs and lows of diabetes. This first part is probably going to be some review for you from our last session when we talked about the introduction to diabetes. So, high blood glucose. What causes high blood sugar? If you ever hear the doctors referring to hyperglycemia, hyperglycemia is the medical term for high blood sugar or high blood glucose. What causes that? Well, your child now has diabetes and their pancreas is not able to secrete the amount of insulin to regulate blood sugar. So without effective insulin, blood sugars are going to run high. If you ever by accident forget or skip an insulin dose, the blood sugar is going to be higher, and you'll know that response at your next blood sugar test because it will be high. Stress does a lot of things on our body. Stress can also cause high blood sugars, along with illness, infection, or injury. If your child was involved in sports, fell down and broke their arm, and now we have a long bone that's healing, that's an injury that's going to cause stress on the body, causing blood sugars to run higher. Symptoms of high blood sugar are listed here. Now, there's handouts here, one for hyperglycemia, and you also have one for hypoglycemia, so that you can get used to what some of those symptoms might be. These handouts are developed in a cartoon character type presentation, and that will help your child to maybe identify with a picture of how they might feel. I would put these on your refrigerator at home so that they can start learning how they might feel with high and low blood sugar. The most common symptom of high blood sugar is increased thirst, and that's because the concentration of sugar in the blood has been so high it makes them very thirsty. So if your child was drinking a glass of water, they put that down, they want more water, that could be a sign that their blood sugars are high. Along with that increased liquid intake, they're going to be urinating more. So very often needing to go to the bathroom. And oftentimes in the middle of the night, you might notice bedwetting accidents. And this can be very normal to have happen. I know that's concerning to a lot of parents if all of a sudden you're done with potty training, or even if you have a teen and all of a sudden they're having bedwetting accidents, you might be wondering what's going on. Well, the urine is so concentrated and they're in a deep sleep, they just can't control their bladders because they're having to urinate. So you may see some bedwetting accidents. Weakness and fatigue are often accompanied with high blood sugar, and this is kind of where they're laying around. They might mimic having a viral illness, and that's oftentimes what drives parents taking their child to the doctor, because they're just thinking they're just not acting right, they might have a virus. They're laying around, not much energy, and that's because of the high concentration of sugar in their blood. With extreme high blood sugar, you might notice visual changes. So if you see your child squinting to watch TV, or they're playing a game, you kind of see them squinting, or they're complaining that they can't see things well at school of what the teacher is displaying on the boards at school. High blood sugars can cause blurred vision. So if you go back to what we talked about in the first session, where the insulin was not able to get the blood sugar into the cells where we want to produce energy, it is almost like you're starving those cells. It's not getting the glucose where it needs to be. So children are hungry when this happens, and they're growing, but they're hungry because the sugar is not getting into the cells where it needs to be. But as those blood sugars continue to rise and they're eating, they may become nauseous, and sometimes we'll even see some vomiting. These are common symptoms also with diabetic ketoacidosis that we'll talk about in a minute. So to treat a high blood sugar, we need insulin in the right dose. Those are the calculations that we're having you work with the nurses at mealtime. But any time that you see those high blood sugars, 250 or higher, we want you to start pushing fluids. Your child should be drinking about 8 ounces or 1 cup of water or carb-free fluid every hour. So water is best if we can have them drink water. If they're nauseous and they want a different type of fluid, diet sodas are fine, but do make sure that they are sugar-free and diet. We don't want regular sodas at this time because that's just going to drive those blood sugars even higher. But sometimes 7-Up, Sprite, ginger ale in the diet form can help sometimes with that nausea. Crystal Light flavors can be used also. Those drinks are all carbohydrate free with a lot of different flavors. And what I would do is try to get your child up and moving around. They're not going to want to be doing a lot, but just some activity will help to have them be a little active and help control those blood sugars a little better. So what we're trying to prevent is a condition called diabetic ketoacidosis. This is a medical emergency where blood sugars have been too high for too long of a period. Fat now is being used for energy instead of glucose, and ketones are being produced. Electrolytes can get off balance. So it's a very serious condition that we need medical assistance in treating. Signs of diabetic ketoacidosis, you're going to see high blood sugar numbers. And this is why I want you to start really monitoring things when you're at 250. So if you had ketones in your urine, you called the clinic and they told you what to watch for, and you continue to check your blood sugars, but no matter what you're doing, they continue to rise, that would be a sign of DKA, along with large ketones in the urine. They're still going to be thirsty and urinating more because of the increased liquid intake, but the last 3 components are going to differ DKA from just a randomly high blood sugar number. With diabetic ketoacidosis, oftentimes children will represent having some abdominal pain. They're laying in bed, they're kind of holding their stomach, sometimes, lying in a fetal position. They might have some moaning and groaning, it just depends. But abdominal pain definitely accompanies diabetic ketoacidosis. You may also notice a weird odor to their breath if they're talking to you. It's kind of a fruity odor. It may smell like bananas or nail polish remover. This is the ketones and the blood becoming more acidic, and you're smelling those ketones and the acidity burn off on their breath. Another serious situation with diabetic ketoacidosis is fast breathing. This is where your child may represent panting for air versus having regular respirations. Anytime you see them panting, it's called Cozumel breathing, you want to get them to an emergency ER, urgent care, because they are in trouble and they do need help. So anytime you see that fast breathing, if you have called the clinic for guidance and you're waiting for a call back and now they're getting more lethargic and weaker, you notice that fast breathing, don't wait for that phone call. Just go to the ER. So to treat DKA at the ER, they're going to use fluids and insulin. So oftentimes they're hooked up to IV fluids along with IV insulin. It takes both together to reverse diabetic ketoacidosis. Call your diabetic team early. Anytime there's any ketones present, I would call them. Let them know. Stay in touch with them. They're your team to help treat your child. They don't want to see your child really sick. This is dangerous. We don't want them to run into problems. So stay in touch with your diabetic team so that they know what's going on. Oftentimes, if we catch this early enough, with additional insulin and fluids at home, we can reverse the process and you don't have to go to the ER. But if they are getting weak and lethargic and you notice that fast breathing, they need medical assistance, so head to the ER. We can try to prevent diabetic ketoacidosis from occurring. Trying not to avoid any insulin doses will help, making sure we're accounting for all the carbohydrate that they're eating at their meals and snacks and dosing with insulin as needed. Checking for blood sugars at least 4 times a day, but more often in this early initial stage of treatment so that we know if we need to adjust insulin dosing. Making sure that you check for ketones when blood glucose is above 250 on 2 occasions, and when your child is ill. Even with a common cold, I would check for ketones. Children can get dehydrated easily. Once dehydration sets in, diabetic ketoacidosis can follow. And again, I can't stress enough, stay in touch with your diabetic team and call them early. Hopefully we can reverse things at home. Now we'll talk what to do about low blood sugar. So now this is the opposite end. Hypoglycemia means low blood sugar or low blood glucose. What could cause my child's blood glucose to drop too low? Well, they are taking medication to lower their blood sugar, and maybe we overcalculated how much carbohydrate they ate. Maybe we didn't have the right dose. Sometimes too much insulin can cause blood sugars to drop too low. When we talk about carbohydrate counting, I'm always going to talk about be conservative when you're counting your carbohydrate. We'd rather give a little less insulin and have their blood sugars run a little higher than give too much insulin and cause their blood sugar to drop too low. Maybe they skipped a meal. Maybe you didn't know they didn't eat lunch at school. Now they came home with a low blood sugar. So going too long without eating can cause low blood sugar. Maybe they slipped outside and were playing on the play set that you didn't know they had slipped outside to play. And we needed to check their blood sugar before that activity, and now their blood sugar is dropping because they needed a snack before that activity. The main thing with low blood sugar, it's going to happen quickly, and once we're in that spiral downward with blood sugars, it's just going to keep getting worse, and we need treatment. So again, symptoms of low blood sugar will be on your handout, but commonly the first symptom might be irritability. Well, we all get irritable for different reasons, and I wouldn't just base it off of that, but this would be where you just were talking with them and they were fine, and now they're kind of a little testy. Shaking and sweating are the most common symptoms, and this would be maybe you saw them pick up the remote to change a TV channel and that remote's kind of shaking, or they're laying on the couch watching TV and you notice beads of sweat on their forehead. Shaking and sweating without any activity can mean low blood sugar. Sometimes our symptoms of high blood sugar and low blood sugar overlap with each other. Oftentimes hunger can be one of those. You can be hungry with low blood sugar. You can also be hungry with high blood sugar. You can have a headache with low blood sugar, but you could also have a headache with high blood sugar. That's why we don't want to base, do I have high blood sugar or low blood sugar, just based on how you feel. We need to check blood sugar levels to know, are we treating a high blood sugar or are we treating a low blood sugar? Don't ignore any of these symptoms. If untreated, they could become confused, they could become unconscious, or even have a seizure. But these symptoms are pretty severe, and you're going to be checking your child's blood sugar often. So we should catch that before we get into these further symptoms of confusion, unconsciousness, and seizure. To treat a low blood sugar, we're going to teach you what is called the rule of 15. So this is one time when your child does need sugar immediately to help reverse low blood sugar. The rule of 15 is this. You're going to check your blood sugar, child's blood sugar, and the cutoff for a low blood sugar is anything lower than 70. So if your child's blood sugar is 70, I would treat it as a low blood sugar. anything 70 or under. And what we're going to do is administer around 15 grams of fast-acting carbohydrate. Fast-acting meaning something that contains sugar. Once you give them the 15 grams of carbohydrate, we're going to wait 15 minutes to allow that blood sugar to rise from the carbohydrate intake. At that 15-minute mark, you're going to recheck the blood sugar, and you'll repeat this process until the blood sugar is over 70. So in this next slide, we show you that you're just basically working in a circle. You find out the blood sugar is 70 or under, you give 15 grams of fast-acting carbohydrate. You're going to wait 15 minutes to allow that blood sugar to rise, and then recheck the blood sugar to make sure that number is over 70. If you're not at 70 or higher, you're going to repeat that process. Usually 1 or 2 repeats will bring the blood sugar up to a safe level. So you may be asking, well, what contains 15 grams of carbohydrate? I have some examples here, and they're also listed on the slide. Carrying juice with you at all times is important because if you're away from home and blood sugar drops, we need something quick to bring that blood sugar up. Juicy juice is a great product to use because it is 100% juice. I wouldn't count on flavored drinks like Capri Sun or Kool-Aid Jammers. Those are sugary drinks, but it's not true juice. Juicy juice is 100% juice. Another product you could do is give them a little bit, a half cup of a regular soda. This is the one time when we say regular sodas would be okay. These little 8-ounce cans actually contain 2 1/2 cup portions. The nice thing with the juicy juice, it's already prepackaged in your half cup portion. I don't have to worry about measuring that out. Whereas with a pop, I would need to try to measure that out in a 1/2 cup portion. There are things in the pharmacies like glucose tabs. These are chalky, they're kind of big and round, and a child would have to eat chew up about 4 of these to get the 15 grams in. So that it's not really the favored type of product that we would use as with a child, but they do work. Another thing you could use are fun-size Skittles or fun-size M&Ms. There's about 15 pieces in here, 1 gram per piece, so you've got your 15 grams in a packet. Other things you can use, there are some glucose gels at the pharmacies that you can use, and a good time to use something like this is if they're not unconscious on you, but they're very, very sleepy, and you're worried if I give them liquids, they may choke. So if they're at that point, a gel might be something easy to use where you would slip this into the cheek pad, and our cheek mucosa is very absorbent, so that glucose just kind of seeps into that cheek pad, which then will go into the bloodstream. But another product you could use is also a small tube of cake icing. I know that sounds weird, but when you look at the volume of this cake icing versus the volume of this gel, this is much smaller. You would deliver it the same way, slip that into the cheek, maybe rub the cheek a little to kind of get things activated, and that's going to slide into the mucosa and then go into the bloodstream. So those are common things that we recommend for children to use to treat a low blood sugar. All those examples have 15 grams of carbohydrate. Now once we have the blood sugar up to 70, that's our safety mark again. And we want to keep that blood sugar stabilized. We don't want it to drop low again. So what I would recommend is making sure after we get blood sugar back to 70 that we provide some protein to help sustain that blood sugar. If the low blood sugar occurred between meals, using something like cheese and crackers or peanut butter and crackers that are already pre-made, that's something easy to carry with you, to have with you at all times. Also, if it's time for a meal, and you notice their blood sugar was low, but they were not showing symptoms of that, back up and treat the low blood sugar first and then allow them to eat their meal. That would be an example that we would not give insulin for the blood sugar because the blood sugar is already below their target. We would only give insulin to cover the carbohydrates in the foods they eat at the meal. Now there may be times when your blood sugar goes so low that a child may not be awake, they may be unconscious. Again, this is going to be very rare because you're going to be checking blood sugars very often and you're going to know those symptoms and you'll treat that low blood sugar before we get to that point. But we want you to be prepared for an emergency. So we will prescribe what is called glucagon. Glucagon is a very fast-acting carbohydrate. It comes as a powder tablet with a syringe of saline that you will inject into the bottle. This kind of shows you the kit. So we have your syringe and we have the bottle. You're going to inject the saline into the bottle. You're going to swirl it, and then it goes into a liquid form. So it starts as a powder and then dilutes to a liquid. A lot of times we panic with emergency situations. In your hypoglucose kit, there will be a picture diagram that will walk you right through those steps, showing you to inject the saline, swirl the bottle, draw it back up, and this is going to go into an actual muscle. We want it to go